Welcome back to Days of Dallas. This is a weird video. I'm really hoping this isn't going to be 20 years long, but I'm going to do my best to not babble. It's quite early in the morning, which is why sound like I've smoked about 40 packets of cigarettes. I don't smoke. Michael T has fallen. It's all, Michael T, you're here for support. It's all happening. Okay. Today, I am here to talk about Dallas on Dallas's Days of Dallas channel. So look, the story starts back when Dallas was a pup. I got Dallas when she was 4 months old, and when I brought her home, she was happy, healthy, running around like a crazy little puppy would be. At 5 months old, Dallas got she ate something and it upset her stomach, and I brought her to the vet, and the vet was very concerned because she couldn't keep anything down. She couldn't, anything she drank, she was throwing up. Anything she ate, you can imagine. So the vet was quite concerned because she was very young. He gave me some tablets to stop her. That's my work phone. He gave her some tablets to stop her from. Is this how this is going? Oh my god. Okay, we need a bit of humor in this, eh? So yeah, he gave me some tablets, take 4, to stop her from, throwing up so much and whatever. And I kind of thought that was that. He did tell me at the time that it was quite serious because she was so young. But anyway, I brought her home, I gave her the tablets, and about 4 hours later that day, she started having seizures. This is all actually documented very early on this channel in a video where I was trying to crate train her. And this happened. I had to abandon the crate training because she really wasn't well. So she had seizures at 4 months old. When I went to the vet, he kind of said, stop her taking the tablets, we're going to hydrate her. She ended up being admitted and put on fluids, and she got over it. She came home. It seemed to be kind of sorted after about 48 hours, and she went on to be a fairly content dog for a number of years. I would say she had more kind of stomach issues than other dogs I would know. She kind of had quite a sensitivity to food. She often would decide that she didn't want to eat, and even for what seemed like no reason whatsoever, she would often have like stomach bugs. She'd often get gastro, and just a lot more than any other dog I've owned or known. Dallas seemed to have a lot of stomach issues. Fast forward then to last February, which I think again is documented on this channel. I got Dallas's teeth cleaned, which was advised by the vet, because she had quite porous teeth. They said when she's eating her nuts, they're coating the teeth, they're getting caught in the pores of the teeth, and then like toothbrushing alone won't clean them. So I booked her in for a dental, and that went fine as far as I knew. When I rang them to collect her, they did say she was taking a little while to wake up from the anesthetic. That at the time was all that they said. I was like, okay. But she did wake up. I brought her home. It took her a couple of days to kind of fully get over the teeth cleaning, but then she was all right for I would say 2 or 3 months. And then in the summer of last year, she started showing some very unusual behavior. So unusual behavior did kind of tie in with me going back to work. I had been working at home since March, and then I went back into the office, and that's when the kind of strange behavior started. And the strange behavior started pretty mild. It would be that just sometimes I'd look at her and she'd look a little bit vacant, like she'd kind of be staring into space. So I'd be calling her name, but she'd be kind of like, and a look that I know well, sitting and staring vacantly into space. And that was how it started. And then there were kind of other little things where she would just be kind of walking, but not walking with any kind of purpose. She'd just be kind of wandering aimlessly. And I was kind of saying this to people and sending videos to people of what she was doing, and I guess everyone else was kind of like, she's just walking around like, what's your beef? But it was just unusual to me. Um, and there was one evening that I came home from work. This basically happened over a period of about, I would say, 3 days. It's not, I didn't leave it for a long time. Um, and it wasn't all of the time. It was just, I'd come in from work and she'd be staring vacantly, and then she'd be fine. She'd have her dinner and she'd be cool. Um, but there was a day when I came in from work when it really seemed like she didn't recognize me. She came and sat on my lap and she was looking at me, but she was kind of like, she couldn't figure out who I was. And that was really worrying. So the day after that happened, I brought her into the vet. I rang them first and I said, look, this is what she's doing. And they said, that sounds a little bit neurological. So bring her in straight away. Like, let's look at her now. I brought her in. They had a look at her. When I brought her in, she wasn't doing these things. She was kind of her normal self. And they said, look, she's not showing neurological signs. All her limbs are moving properly. She's quite bright. They were kind of clicking around her eyes and she was responding. They'd pick up her paws and she'd respond. They'd ask her to sit and do tricks. They checked everything. And they were happy enough at that point. Now, they did say to me at that visit that there was a note on her file after she got her teeth cleaned saying, took a long time to woke up from anesthetic, problem with liver, question mark. They did not tell me this after I got her teeth cleaned initially. I'm not sure it would have made a difference, but I'm noting it here because it is something that happened. So anyway, at this appointment, they said, look, she's not showing neurological signs right now. Maybe she's just a bit anxious. Maybe it's like separation anxiety because you've gone back to work. So they recommended putting her on Calmade, which is a dog. It's basically like, I'll have to look at the ingredients or I can link it down below or something. I'm sure it helps some animals. It did not help Dallas because she wasn't anxious. But anyway, they sent me away with that. They told me to come back in 2 weeks. They were very specific about, or maybe it was even a week. I think originally they said come back in a week and they changed it to 2 weeks because she wasn't showing neurological signs during that time. So I brought her home. I put her on the Calmade. I can't really say that the Calmade did anything, but she did go through a period of not showing this wandering and this staring vacantly. Now, as time went on, we did actually go back, for the second visit. I know this is a little bit all over the place. And they said, look, she's not showing signs. Let's call it anxiety. And off you go. So that was that. The more that I went back to work, I went back in an increasing amount of days. It did seem like the wandering came back. And the wandering would be as simple as she'd be in this room and she'd walk over to a wall and she'd stop. And she'd just stare at the corner of the wall. And then she'd turn around and she'd come back. And she'd stare at this corner of the wall. And it went on like that for a while. Around Christmas time, she did seem to get a bit stressed. She was finding it hard to sleep at night. And she started chewing on the bars of her crate, which she's never done in her life. And it was all, thinking back now, it was so obvious something was wrong. But when things happen, this is like me defending my actions, I guess. In my head, I was like, I brought her to the vet twice now. Both times they're telling me it's anxiety. But I couldn't really shake the feeling that something wasn't right. Anyway, this all came to a head on Valentine's Day. I'm going to fast forward a little bit. Valentine's Day of 2021. And her behavior at this point on this day was insane. In the morning, she was fine. She got up. She was lying on my bed beside me. She was as cute as can be. She had her head on the passenger pillow, is what I'll call it. I was rubbing her. I was talking to her. I was playing with her. She was happy as can be. About an hour later, the pacing started. She was walking around the kitchen. The pacing got worse. I have some footage of the pacing, which I'm going to pop in a minute. Actually, maybe I'll just pop it in now. But it got really, really, really bad. So I'm going to put that in here. Come on out here, puppy. Dallas, come on. Come on, come out. So you can see there that's quite upsetting to actually look at. By the point this had happened, I had already called the emergency vet, and she had said it was a Sunday. Valentine's Day this year was a Sunday, which wasn't ideal because no vets were open. So she asked me to record a video of what Dallas was doing and send it on to her. Those were the videos that I sent her. And you can see in particular in the third video, she is pushing her head against the ground outside. That is behaviour that she hadn't done up until that point. At that point, the vet said to me, bring her in now. So this is editing Siobhan checking in from the future. I filmed this video about a month ago. Today is actually the 2nd of June, when I'm just editing it and trying to put it together. And when I recorded it, I hadn't watched the footage from Valentine's Day. I hadn't watched it back. I had lived it, but I hadn't watched it. Watching it now, it feels like somebody is ripping my heart out of my chest. I can't believe she was that bad. I mean, it's on Sunday. Today's Wednesday. On Sunday, it was 15 weeks ago that this all happened, and it feels to me like it's somebody else's life. I can't remember her being this bad, which just shows that my brain has decided to block it out. It's horrific to watch, and I can't believe she had to go through that, my poor little dog. And I just want to clarify here before I go any further, this was extreme. She was not like this in the days, the weeks, the months running up to. This was completely, this was the worst by far. Prior to this, she had just done a slight bit of wandering and then snapped out of it, almost a shake of her head, and she was back to herself. So this is, I can't, I'm struggling to watch it, and I'm really tempted to not put it in, but this is the reality of a shunt. I brought her straight in, and she said to me, like, bear in mind as well, this is COVID time, so you're not supposed to be allowed in. In this instance, they did allow me in, which I'm very grateful for. They decided to sedate her and said they were going to take some blood tests to try and figure out what was going on. So she told me to go home, and she said she'd call me in a couple of hours with what the blood test shown. So I went home. I got the call about 2 hours later to say that they were very confident there was a problem with Dallas's liver. They said her blood test, or basically they do a thing called a bile acid test, and in a normal healthy dog, the bile acid result would be between 5 and 10, and Dallas was at 75. So it was very obvious to them there was an issue with the liver. Now, they did say to me that I had to prepare for the worst. They said this is not good. This is really not good. And they, I don't want to say they were then and there advising me to put her to sleep, but that was the impression I got from them. They did say if they weren't equipped basically to do scans on her liver to see what was going on, but they could refer her to somewhere else. And they did originally say they were going to refer us to a surgery in Meath, and that surgery in Meath actually refused to see her because they said there was no point. If her bile acid test result was that high, there was no point seeing her. So that wasn't very positive at the time. But they said, look, there is another surgery in Cork who may be willing. So she rang them. They said, yeah, bring her in tonight. I drove down to Cork that night. It was about 11 o'clock at this stage. And again, because of COVID, I couldn't do much. I have to wait outside in the car. A very unbelievably lovely guy came out to the car. He met me, he met Dallas. He told me what he thought was going on, and he said, look, she is displaying all of the signs of what we call hepatic encephalopathy, and that is a symptom of a thing called a portosystemic shunt. And I, at this moment, I'm going to get up Google to tell you what a portosystemic shunt is, because it will explain it better than I can. So this is a portosystemic shunt fact sheet. So portosystemic shunts are abnormal single or multiple blood vessels which directly join the blood supply from the intestines to the main circulation. In a normal animal, blood draining from the intestines passes immediately through the liver for nutrients to be processed and toxic substances to be removed prior to the blood entering the main circulation. In an animal with a portosystemic shunt, a significant volume of blood bypasses the liver, entering directly into the blood flowing back to the heart, where it is pumped around the body. So in Dallas's case, 80% of her blood was bypassing the liver, which is an unbelievable amount, right? This article goes on to say, different types of portosystemic shunts exist. Shunts in young animals are generally congenital, i.e. they are present at birth due to abnormal development of the fetus. In Dallas's case, this is a congenital shunt. She was born with this condition. The way the vet described it to me, I'm going to break it down because that's a lot of technical, is that there is a vein coming out of Dallas's liver that should have closed when she was 2 weeks old. In a normal healthy dog, that vein would have closed. In Dallas, it didn't. And because that vein didn't close, blood is bypassing her liver. So her liver hasn't been functioning correctly for the entirety of her life. So that's basically what he said. Right, so these are broadly categorized into those which are accessible outside the liver, extrahepatic, and those which pass through the substance of the liver, intrahepatic. Dallas has an extrahepatic shunt, or had. So this says, what signs does an animal with a portosystemic shunt show, right? So many of the clinical signs are a consequence of the blood flowing from the intestines not passing through the liver. So exactly what was happening, 80% of her blood was bypassing her liver. As this blood is in effect unfiltered because it's not passing through the liver, high levels of substances toxic to the central nervous system are pumped directly to the brain, causing the animal to show neurological signs. So this is exactly what was happening to Dallas. These neurological signs are variable but can include hyperactivity, restlessness, lethargy, apparent blindness, incoordination, stupor, coma, and seizures. So there's one of those that she didn't have, which was coma, thank God. In many cases, these signs are seen or become worse after feeding when higher levels of these neurotoxins are present. I can't say this is really true in Dallas because she had a real hesitancy to eat. So which makes sense now because some part of her little doggy brain was going, when I eat, this makes me feel really bad. So she would take a few nuts throughout the day consistently. So it wasn't so clear that it was because it was food related. Other general signs can include poor condition, not true in Dallas's case, growth and development, not true in Dallas's case, vomiting, diarrhea, and cystitis. Again, not really I couldn't really see that in Dallas. She was a bit more prone, as I say, to gastro and things like that, but I can't say that she had any of those last few. The vet did say to me, normally dogs with a shunt will not grow to full size. Dallas is her full size. They'll normally have a terrible coat. Dallas has a great coat, and it's always commented on that her coat is in great condition. So she's just a bit of an anomaly in that way. So basically that night I admitted her. She was in the surgery for 3 nights, and they were very positive. They were very, very positive in contrast to the other vet experience that I had. They kind of said they did a CAT scan on her. They did a whole range of blood tests. They said, we've identified what we think is a shunt. It's very hard for them to actually identify it until they do surgery. They said, we've identified what we think is a shunt on the CAT scan. It is extrahepatic. We think we can operate. If you want to operate, give us the go. And the alternatives were not so good. It was either, number one, she gets surgery. Number two, she goes on medication for the rest of her life, and that could allow her to live for a few weeks, a few months, a few years, but her life would be significantly reduced. Or you do nothing and she'll have to be put to sleep. So those were the options available. Hi, beautiful. Do you want to come here? Come on. Dallas wants to feature in her own video. Yes, you're so good. Yes, I'm talking about you. Yes, I am. Oh, thank you. So I asked the vet what would he do if it was his dog, and he said 100% he would do surgery. Thank you for kisses. He would do surgery. So that's what we did. I booked her in. She got put on some medicine called lactulose and some antibiotics for 2 weeks prior to the surgery. Ended up being 3 weeks just because of COVID delays. During that 3 weeks, she did not have a single seizure. She showed no signs, so the medicine worked. She was also put on a hepatic diet, which is Royal Canin hepatic dog nuts, and she didn't show a single symptom. The whole point of that period of time was to get her really strong before... Right, my phone has stopped beeping now. The whole point of that time period was to get her really strong and just get her system in a good place so she'd be able to cope with the surgery. Okay, and that brings us up to the jeepers, where were we? The 11th of the 3rd, so the 11th of March 2021, Dallas had her surgery, and I have her notes here. They were very comprehensive, but basically they had written here, Dallas presented for surgical management of an extrahepatic portosystemic shunt. She was bright, alert and responsive on admit. Her vital parameters were within normal limits. So she had to have surgery for the shunt, and she also had to have surgery on her, was it her bladder? I think because of the shunt, she had an awful lot of bladder stones, so she had to have surgery on that as well. She was admitted in the surgery, my understanding of this, and it says it all here, but it says it in really like surgical vet terms. They partially closed the shunt with cellophane. I would call it cling film. They partially close it with cellophane, and then over time the rest of the shunt will close. That's what they hope will happen. She had her surgery, they stapled her up. They have here, anesthetic recovery was uneventful. The patient was warmed using a bear hugger warmer, which I just think sounds so sweet. She stayed in the hospital, in the vet hospital, for a couple of days where she was monitored constantly. With a shunt, the big danger period is the first 3 days. If they get through the first 3 days, they've kind of passed the major surgery risk of having seizures. Thankfully she did. They gave me, there's so much to talk about here, but she wasn't allowed to do any exercise at all for 2 weeks. She had these staples in. A big trigger warning for people who are afraid of these things, but this is an image of her wound after the surgery. So we had to be very, very careful with that because Dallas is quite a live wire. She hops, she jumps, she runs. She's used to jumping on beds, jumping on couches. I had to stop her from doing all that. We ended up sleeping on the floor of this room, so she didn't have to go up the stairs. And because she'd had surgery on her bladder, it meant she had to pee all of the time. Like she was peeing a lot. And what was bizarre, in a dog with a shunt, they say they normally drink an awful lot of water because there's a problem with the liver. Dallas never really drank any water, but since she's had the surgery, she does drink a lot more water now. To give you an idea of how much medicine Dallas was taking, the number one medicine that Dallas was taking was a thing called lactulose. So we had, if I can pick all of these up at the same time. We started pre-surgery with 3 bottles of lactulose. She got through all of that pre-surgery. After the surgery, she continued taking lactulose. It's a full bottle gone in the 6 weeks after her surgery. She also took Noraclav tablets, which was an antibiotic medication. She had to take that for, I think, 4 weeks, twice a day. She was taking Calpol. That was her pain relief. She took omeprazole, which I have somewhere, which was a antacid medication. She also took, what's this one? Oh no, we'll get to that in a minute. Losec. What is Losec? 7 by Losec. I can't even remember what that one was. Like, this is only some. There are more and more. I have a basket full of these, and these are just the ones I didn't throw away for dramatic effect for the video. She did, yeah, there's more and more and more. Oh yeah, this, she wasn't long home. Serenia, I can't actually remember what half of these are. Serenia, this one, basically I had her home a day and she started throwing up bile and she had to be put on these as well. So between her lactulose, her Noraclav, her Calpol, her omeprazole, her Serenia, her, what's that one? Yeah, look, there was a lot of drugs, I'll put it that way. After 6 weeks, she was due to go back to get her final recheck. They do basically a big blood work check and they see where the liver is at, kind of. So we didn't actually make it to the 6 week checkup point. Exactly 5 weeks to the day after Dallas had her surgery, she started showing some stomach issue symptoms, is the easiest way to say it, where there's no polite way to say it. She was pooping blood. That's what she was doing. It happened twice on the Thursday, which was exactly 5 weeks to the day after her surgery. I rang the vets who had done the surgery, and they, because we're still in COVID times, and technically you weren't supposed to leave your 5k, much less your county, and it was also a Thursday night, they kind of said, look, we don't think that this is related to the surgery. We think she just might have a little bit of a stomach infection. Go to your local vet and they will get them to have a look at her. So I got off the phone to them. I rang the local vet and they said, look, just to be on the safe side, bring her in first thing in the morning. So I did. The next day, the Friday, I brought her in and they said to be on the safe side, just because she'd had her surgery, they were going to run some blood tests just to see what was going on. I brought her in, they did the blood tests. They had told me I could collect her in 20 minutes, and because you're not allowed to go in, you're kind of sitting outside in the car waiting for the call to say come and get her, and that call just didn't come. After about an hour I rang them and I said, is everything okay? And they said, look, we've done the blood tests and there were some inconsistencies. Because of the inconsistencies, we've run a bile acid test, which is what originally showed there was a problem. And they kind of said, you can come in anyway and take her home, but we don't want to prescribe anything until we talk to the surgeon. And there was a whole ridiculous series of events that played out that I'm not going to get into because there's just no point getting angry about something that has passed. But long story short, Dallas was very sick all weekend. The vets here couldn't give her any medicine because they couldn't act without hearing from the surgeons in Cork, and the surgeons in Cork, for whatever reason, couldn't get in touch with them. When it got to Monday, Dallas was very kind of dehydrated and had been through a lot. Like, she woke up in the middle of Sunday night, probably about 2 a.m, and was shaking like a leaf because she had to go to the bathroom, basically. On Monday, the vets here did give her an antibiotic, and they gave her something, I can't remember the name of it, but it was like the doggy version of Diorolite. And that really helped her almost immediately. She stopped having the symptoms. And the surgeons in Cork decided to bring her down early for her 6-week check. So there was actually only really 2 days in the difference by the time we got around to it. But I brought her down and they did blood tests. They didn't feel the need to do any scans, and they sent her home with me. She carried on with the antibiotic for about a week. And then on the day, six weeks to the day after her surgery, the surgeon rang me with the blood test results. He said, look, there are some inconsistencies in her blood work. So bear in mind, at the start of this audio novel, I said a normal dog would have a bile acid range of 5 to 10. When Dallas originally presented on Valentine's Day, her bile acid result was 75. And 6 weeks after her surgery, her bile acid result was 175. So that's absolutely off the charts. And that was what had caused the vets here to really panic. But the surgeon did say, he was like, look, she was very early in her recovery. Her liver hasn't worked for the majority of her life, so it's going to take some time for it to adjust. He said he was happy enough with the way she had presented to start weaning her off all medication, and he basically said that's kind of it. Unless we notice seizure behavior or unusual activity, there's no reason to bring her back. And I'd asked him, you don't want to do a scan of her liver or anything like that? He said there's not really anything to be learned from it. He was like, there are dogs who would be thrown down on the ground, who can't get up, who can't run around, who can't eat, things like that. He was like, those are the dogs we're concerned about, those are the dogs we'd scan. Whereas Dallas was like a little live wire running around crazy excited. So that was kind of it. Over the past 3 weeks, we have taken her off all medication. She is now medication free. She was 9 weeks post surgery yesterday. She's 12 and a half weeks since the original admittance to the animal surgery. So a lot has happened in the past 3 months. It's been a bit of a crazy journey. The only thing now is that she is on a hepatic diet for life. That's what, which is like no big drama. She really likes it. She's pretty much back to herself. Within about 2 weeks of the surgery, she got her staples out, and the wound has healed like perfectly. You would have absolutely no idea that she had had surgery. I can rub her belly. She's been to the groomer. You would have no idea that she had had such a major surgery. She's back doing 2 walks a day, up for play. She's, thank the good Lord, not had any seizure activity. But I suppose the reason I wanted to make this video is because when I found out, like at this point I'm able to talk about it reasonably composed, but the past 3 months have been incredibly difficult because I was told on at least 4 occasions that she'd have to be put to sleep, and that the outlook wasn't good, and that consistently along the way I've heard those things from trained professionals. And it's scary and it's sad, and I kind of refuse to believe that that was the case. I think the message I want to get across in this video is sometimes a second opinion is really worth it, because if I had listened to the very first vet, she might not be here. And we're now 12 and a half weeks later, and she's here. She's snoozing at my feet. You saw her jumping up here earlier. We're about to go out for a WALK in the next 20 minutes, and she might not be here because I listened to that first vet. And even along the way, even after the surgery, I was told it doesn't look like the surgery's worked. When her bile acid result was quite high, the same vet told me, it's not looking good. And I've heard that repeatedly now, and I refuse to listen to it. The surgeons are positive, and I'm going to trust them, and I also just feel like it's worked, and that's what I'm going with. I'm having faith. My best girl is here, and she's happy. out of everything else, the message I want to get across in this video is if you have an animal that you care about, or you have a family member or a friend who has an animal that they care about, please, please, please get pet insurance. I have pet insurance for Dallas. If I didn't, the cost of these things is absolutely astronomical. Astronomical. And I'm not going to get into the cost because I'm in Ireland and I don't know where anybody in the world who is facing a portosystemic shunt might be. The cost is astronomical. Get pet insurance. Even the first night when I very first brought her to the surgeon, I didn't even enter the building because of COVID. It was just a conversation. I had a bill of €800 night one before anything had even happened. So before they even knew what was wrong. I know they had their suspicions, but please get pet insurance. I had it. Don't make the mistake of not having it, because it's the difference in your pet living and not living. It's the difference in hope and no hope. It's the difference in having the ability to make a choice. You know, if I didn't have pet insurance and I just went to that original vet and they said, we think you should put her to sleep, that would have been the option. They wouldn't have suggested going to the super specialist. And they only did that because I had insurance. So I don't know, like my pet insurance for Dallas is about €200 a year. It's not a big expense considering what the expense could have been if I didn't have it. So please get pet insurance. And that's kind of it. I guess that's what's been going on this year. As I say, as much as I'm able to talk about it now, it's been a very difficult time. There's been lots of tears, there's been lots of worry, there's been lots of sleepless nights. There's been so many prayers, and thank the good Lord, because I fully feel like he's on her side, and he's minding her and minding me, and all of my friends who prayed for her too. When all hope was gone, there was still hope. So that's it. That's the story of Dallas and her portosystemic shunt. It might help somebody, I don't know, but I've seen it a couple of times on Instagram and stuff where people were also told a portosystemic shunt is the end of the road, and it doesn't have to be. Maybe it does, maybe for some dogs they can operate, but I think if you love your pet and you're in a position where you can get a second opinion from a vet surgery that has carried out surgery on a shunt. So yeah, I think I'm going to sign this off there because my work phone is still beeping. I know that's like the longest talking video ever, but my girl is here and thank God for that. And yeah, I'm going to sign this off.